Hi, my name is Dr Alia. I'm a consultant dermatologist and I have a special interest in the psychological impact of chronic skin conditions, otherwise known as psychodermatology. Psychodermatology is the part of dermatology that considers both the mind and skin together when treating someone who has a skin problem. I know as a dermatologist that my patients are more likely to have issues with self-esteem, low body confidence, embarrassment, and anxiety. In this case, my job is to treat not only the skin condition, but also the psychological impact it's having. The patients I see include those who have a chronic skin problem that has a large psychological impact. For example, eczema, psoriasis, acne, vitiligo. I also see patients with psychiatric problems that present to dermatology clinics. For example, those patients who are skin pickers, hair pullers, and body dysmorphia. Patients will come and see me in a psychodermatology clinic for a number of reasons. One of those is having a chronic skin disease with a large psychological impact. For example, somebody who has moderate to severe acne and is having a large impact on their quality of life. They may feel anxious when they're going out, they may feel embarrassed, and they can't do the things that they want to do. These patients require treatment of their acne, and they also require some treatment of the psychological impact, and this can be through talking therapies or medical management if needed. The other group of patients that I see are those who have a psychiatric issue and this presents in their skin. For example, hair pulling or skin picking and body dysmorphia. These patients require a different type of treatment, which is usually more rooted towards the psychological aspect. However, we do also treat their skin issues at the same time. Treating the mind and skin together is basically the main aim for psychodermatologists. Skin problems can affect mental health. We know that people with skin problems are more likely to develop issues like anxiety, depression, and worryingly suicidal behaviour when compared to those people who don't have a skin condition. What I hear from my patients is that they can feel embarrassed, have low body confidence, feel ashamed of their skin, and have issues with developing relationships and also progressing in the careers that they want to, and this is all in relation to their skin. Understandably, this will impact a person's mental health. Everybody deals with skin problems differently, and they can affect some people more than others. Feeling emotionally distressed can make some skin problems worse. This is mediated through the stress response. Feeling emotionally distressed causes release of the stress hormone known as cortisol, and this has several effects on the skin. It can affect the immune system and delay wound healing. It can also disrupt the skin barrier and make the skin produce more oil than usual. We see on our skin problems like redness, itching, lines, wrinkles, pigmentation problems, signs of premature aging, dull or uneven skin, and also spots. Retouched or filtered images of skin can affect some people's perception of their own skin and how they feel about themselves. It creates an unrealistic expectation of flawless skin where you can't see any facial hair, you can't see any pores, and you can't see any scars. And this can make some people feel that they need to achieve that. However, we all know that we all develop a bad hair day or a bad skin day. Things don't always go as we plan, and reality is that not everyone is flawless. Filters can affect some people's perception of real skin. By not including normal variants like facial hair, changes in skin tone, depth of colour, wrinkles, scars, lines, spots, we're creating a perception of perfection which is not achievable by most people. My top tips for feeling confident in your own skin are firstly to see a medical professional if you have a skin condition that's affecting your quality of life. It's important to have skin conditions treated appropriately, and this can minimize psychological impact later on in life. You should also try and speak to people about your skin, the people that you trust. Tell them how you're feeling and discuss your skin problem if you feel comfortable. I also suggest keeping in touch with national organisations that are for your skin problem, for example, eczema, psoriasis, or vitiligo. I also think it's really helpful to follow the skin positivity movement in order for you to feel that you're not alone, and also you can gain some further ideas from these really impactful influencers. If you have a skin condition, there are some simple things you can incorporate into your daily routine that encourage positivity. One of these is positive affirmations. When you're looking at yourself in the mirror in the morning or going through your morning routine, say positive things to yourself, like I'm true to myself, I never give up, I am worthy, I am unique, I respect myself. The beauty industry is in a unique position to encourage self-acceptance and show real skin. This can be through inclusive advertising, shifting the focus to natural skin, and supporting the skin positivity movement, and really encouraging people to love the skin they're in. My advice to anyone feeling low because they have a skin condition is firstly to seek the right amount of help. This can be through your close friends and family. It can also be through a healthcare professional. If you continue to feel low, look at national organisations for your condition to see what other levels of support are available. Please don't hide how you're feeling. We want to hear and we want to help. Thank you for watching. Check out the link to learn more about Skin Proud's campaign to end photoshopping in skin adverts.